Is transconjunctival blepharoplasty safe? First, to answer whether transconjunctival blepharoplasty is safe, we have to describe what is transconjunctival blepharoplasty. Realize that there are two approaches to lower blepharoplasty. One is by making an incision through the skin. That's called transcutaneous. The other is to make an incision inside through the mucosa. That's transconjunctival approach and the blepharoplasty that goes with it. For me, I look at the individual patient and what they have as to which approach I choose. If the patient has only a bulge of fat but no extra skin, I use the transconjunctival approach because we can get the fat out safely, very safely, and effectively through this approach. If the patient has redundant or bulgy fat and extra skin and wrinkles, I use the transcutaneous approach because that allows us to take out the fat or move the fat, transpose the fat, and to remove redundant skin and muscle that causes these wrinkles and crow's feet and other things like this. So I first would talk about why I'm using the approach. But let's say that we've decided that the patient has bulging fat only. Then, and only then, do we use the transconjunctival approach. That approach is done with an incision in here. And with a surgeon who knows the anatomy and who's safe, this is an extremely safe surgery. Through it, we can either one, remove fat, or two, transpose the fat, getting rid of the bulge and adding it to the rim where we're more concave or indented. We're essentially robbing Peter to pay Paul. The Peter is the full bulgy lid, and the Paul is the concavity underneath the bulge. How long does this last? Well, it depends what the aging eyelid situation is. If the aging eyelid situation is skin redundancy and we're going through the skin and taking out some redundant skin, as the individual ages, they can get some more aging of the eyelid and they may get a little more redundant skin. If it's bulgy fat, realize we don't take out all the fat, we leave some fat because it's fat in a cone of fat that's along the orbit and it protects the eyeball. So that fat can re-herniate over the years. But usually this lasts for many, many years. I would say at the minimum 7 to 10 years. Is this a painful surgery? It really is not. It's not uncommon, even though I give an individual, a patient, narcotic pain pills, it's not uncommon for them to use none of them. I don't like them to get home that night and have no narcotics, but it's not uncommon for the individual to use acetaminophen only, Tylenol only. So it's not a particularly painful thing. And that pain is further diminished if the patient doesn't do too much and if they ice their eyes. Lack of activity and icing the eyes diminish the pain, and usually a very small amount of pain medicine or none is necessary. How long does it take to heal from lower blepharoplasty? Again, it depends what gets done and if other procedures are done at the same time. But if a lower blepharoplasty alone is done, the eye can swell and bruise a little bit. Usually that swelling and bruising is gone within 5 to 7 days. And if it's a woman, they can wear makeup on their eye. It depends if the transcutaneous or the transconjunctival approach is used. Usually after the swelling is down, the patient really feels healed. They may have some low-grade swelling for a month or two, but in reality, most people can be entirely back to work in 5 days. If you have questions about lower blepharoplasty, upper blepharoplasty, any periorbital surgery, or any surgery about the face, call me, email me. I do a very detailed, individualized consultation where I determine what is best for you. I'd love to see you in my office. Thanks a lot for watching.